AliSKhan, the next pandemic, on the front lines against humankind's gravest dangers. Embark on a thrilling journey with AliSKhan, a renowned immunologist and epidemiologist, as he recounts his experiences combating some of the world's deadliest diseases. In The Next Pandemic, on the front lines against humankind's gravest dangers, Khan shares captivating tales of investigating outbreaks like the 1918 flu epidemic, hantavirus, Ebola, and even the repercussions of Hurricane Katrina. The summary will delve into the importance of a global public health structure, and how Khan's fieldwork aims to understand disease transmission better, to prevent future pandemics. Furthermore, it highlights the involvement of local customs, complex communication, and political events in managing public health emergencies.
Disease control and prevention. Veteran immunologist and epidemiologist, AliSKhan, draws from his 25 years of experience at the U.S. Centers for Disease Control and Prevention, CDC, to highlight how the organization responds to global disease outbreaks. From anthrax attacks in Washington, D.C., to disaster conditions after Hurricane Katrina, the CDC employs a three-pronged strategy of assessing local health systems, analyzing disease or threats, and conducting field studies. Khan stresses the effectiveness of simple interventions such as promoting handwashing or supplying clean water in combating disease outbreaks. The Unpredictability of Influenza. In his book, The Next Pandemic, AliSKhan reveals the unpredictability of influenza outbreaks and the challenges faced by epidemiologists in trying to manage them. One of the most serious diseases discussed in the book is influenza, which can experience genetic shifts resulting in new versions for which people lack immunity. The 1918 flu epidemic killed millions of people globally, and a similar epidemic could occur at any time. Despite efforts to develop a universal flu vaccine, vaccines can still be ineffective, especially for the elderly. Public health emergencies, including large outbreaks, need to be managed as political events from day one. While Russia made flu shots with live but weakened viruses, the West used dead viruses and a residue of proteins to activate immunity, and the effectiveness of the two strategies was found to be roughly equivalent. With flu strains circulating globally, nations are working together within a global public health structure to fight these outbreaks. The mysterious disease, Sin Nombre. A CDC team in the early 90s investigated a strange disease called Sin Nombre, affecting Native Americans in the U.S. Southwest. It was related to hantavirus but didn't affect the renal system. The team traced the disease back to an Idaho man in 1978 and found cases as far away as Florida. Extensive research is required to identify the virus host and populations who get sick. Scientists investigating hantavirus pulmonary syndrome in South America realized how human activity contributes to transmission. Brazil's clean air policies gave the rodents a new habitat. The Sin Nombre disease still remains a mystery. The deadly zoonotic disease, Ebola. Ebola is a zoonotic disease that is caused by a virus that can cause internal and external bleeding. The virus is transmitted to humans through contact with bats or by consuming wild animals from the jungle. In the mid-1990s, a CDC team went to Zaire to investigate a serious outbreak of red diarrhea, which turned out to be Ebola. The virus has been lurking in the wilderness for decades and can emerge in different places where people eat bush meat. The death rate for the Zaire strain can reach more than 80%, while male survivors can transmit it sexually for up to 9 months. Fieldwork in Kikwit, the capital of Kwilu province, was challenging because of local customs that helped spread the virus. The team had to persuade the locals to change their traditions, locate patient zero, and outfit the clinical team with proper protective clothing and equipment. More than 300 people got sick, and 81% of them died. The virus is still a threat today, and people must remain vigilant in preventing its spread. Microbes and the threat of monkeypox. Microbes exist in every human body and play a crucial role in diseases such as smallpox. Scientists eradicated smallpox partly because it only spreads from human to human. However, monkeypox, which inhabits animals, is a dangerous threat as it can spread among people without an animal host. The CDC investigated an outbreak in Zaire's capital, Kinshasa, to confirm if it was spreading from human to human. Fortunately, no evidence of person-to-person transmission was found. Despite this, international trade can unknowingly import diseases. In 2003, monkeypox appeared in the US for the first time, transmitted from an infected pet prairie dog, housed with imported Gambian rats and dormice. Tracing the anthrax attack. In 2001, the US faced an anthrax attack through anonymous letters sent to different locations. The bacterium, which spreads easily, had been studied by multiple scientists, including the Soviets. The CDC responded by creating the Bioterrorism Preparedness and Response Program. Through centralized testing and investigation, they traced the anthrax to a single postal facility and eventually to Bruce Ivans, a scientist at Fort Detrick. It took 7 years to identify Ivans as the culprit. Deadly outbreaks. Diseases spread opportunistically and scientists work tirelessly to trace and contain them. Deadly pandemics like the plague, SARS, and avian flu have ravaged populations, killing millions of people over the centuries. Outbreaks occur through various channels such as mosquitoes, fleas living on rats, and contaminated animal shipments. Scientists monitor virus variants closely to predict and contain stronger strains. The book traces the efforts of epidemiologist AliSKhan and his team at the CDC to investigate and contain outbreaks globally. The team worked to create a linear thread that traced the progression of SARS, identified coronavirus, and worked with Virginia chicken producers to prevent the spread of avian flu. The book highlights the lessons to learn from past pandemics and the importance of global collaboration in containing lethal diseases. Rebuilding public health in Post-Katrina New Orleans. After Hurricane Katrina ravaged New Orleans, the CDC was tasked with rebuilding the city's public health infrastructure. The failure of the levees disproportionately affected poor and elderly residents. While working to provide healthcare services, the CDC team faced inadequate communication and leadership. Concerns about the toxicity of floodwater were addressed, but mold and damaged homes proved to be a more serious health issue. The recovery effort failed due to ineffective communication and FEMA's failure to prepare for the storm. The campaign's inequality highlighted the painful truth that predominantly white suburbs recovered faster than other areas. Khan's fight against Ebola. In 2015, Dr. Khan and his team returned to Africa to combat the Ebola virus once more. The CDC's goal was to bring the number of new cases down to 0. Dr. Khan researched the disease in 4 communities in Sierra Leone, educating the locals about how cultural traditions contributed to Ebola's spread. The locals were hesitant to cooperate with a quarantine and clung to local burial practices that enabled transmission. The involvement of the military in containment efforts helped ensure accountability and made the bureaucracy more efficient. The CDC team had to appear as providers of solutions, not experts who flew in to give orders. Community engagement was crucial in gaining trust and aiding relief and containment efforts. Dr. Khan believes that the West must plan for a global response to pandemics instead of waiting for them to make their way to Western shores. Fighting disease with clean water. The Carter Center's successful eradication of guinea worm in Africa demonstrates the importance of providing clean water in combating diseases. However, microbes continue to pose a threat, adapting and becoming resistant to antibiotics. The increase in international travel necessitates a comprehensive approach to combat the unknown illnesses that may arise with climate change. All nations need competent public health systems, and the U.S. must acknowledge the reality of global warming. The United Nations should establish an Undersecretary for Health Security to prepare for future epidemics.
AliSKhan's gripping account of his adventures combating lethal diseases in The Next Pandemic emphasizes the vital role of preparedness, communication, and understanding cultural nuances in dealing with outbreaks. This summary has highlighted key insights into handling diseases like influenza, hantavirus, Ebola, and anthrax. It has also illuminated the challenges that experts like Khan face while trying to unravel the mysterious origins of outbreaks, earning trust from local communities, and adapting to the political implications of large-scale health disasters. Ultimately, it underscores the urgent need for nations to adopt a proactive, comprehensive approach towards public health, and prioritize global cooperation in order to prepare for the unpredictable dangers humanity may face in our rapidly changing world.